Hello, everyone, and welcome to my presentation entitled how Inge already said. Okay, as a background, EBL represents a major threat for the Romanian cattle sector. Official control measures that are practiced worldwide in the control of EBL includes screening or surveillance of cattle for presence of BVL antibodies for evaluation for intra-community trade, movement control, and stamping out. Unfortunately, no vaccine is available for EBL up to date. So the disease was first reported in Romania in 1954, diagnosed in a Dobroja Red Bull. Eradication efforts have been carried out in Romania since the first detection of the virus was. So currently, the high incidence and widespread geographical distribution are aided by the semi-feral animal husbandry system practiced in Dobroja. Their cows are kept on isolated islands in group of 20 to 40 individuals. The hematophagous insects from Danube Delta, from that area, are vectors for countless diseases, including EBL, being influenced by the favorable wetlands environmental condition. Given that, spread of EBL between herds can occur via infected cattle, preventing contact with infected blood is the most important measure for prevention. The overall objective of the current data report was to evaluate EBL surveillance strategies and to highlight the strength and weaknesses of the strategy that was applied in Romania between 2017 and 2020 in the Danube Delta area. Since 2016, in Romania, an official EBL CP is in place. Enrollment in the CP holdings in which all animals over 12 months of age have been tested negative for 2 consecutive tests, obtain the official EBL free status. Once a herd is classified as EBL free, all restrictions are eliminated. In cattle herds free of EBL, serological surveillance in all cattle over 24 months of age is performed once a year to maintain the official free status. Individual blood samples are collected and submitted to the laboratory for serological examination by ELISA. Seropositive animals have to be slaughtered within a maximum of 30 days from the diagnosis. Furthermore, the farm is placed under official restriction measures. The EBL health status of the herd is suspended until all animals over 1 year have reacted negative for 2 consecutive serological tests performed at an interval of at least 4 months and at most 12 months. The movement of animals between herds within other countries is allowed after performing a serological test with a negative result 10 days before the movement. The basic strategy always involves active surveillance and slaughtering of infected animals, transport, and movement restriction within the county. Data on the epidemiological situation of EBL was collected from the administrative territorial structure of the national authority. Parameters such as number of localities with outbreaks, infected animals, and the total number of cattle population for each year were used to calculate the incidence and prevalence of EBL disease per year in the studied area. Prevalence rates were calculated with the number of animals for each area separately, Danube Delta and the mainland, both in the same county. The outbreaks of EBL occurred both in the mainland and Danube Delta. In 2018, a non-significant increase of EBL localities with outbreaks was observed in the Danube Delta, while in the mainland, the number of infected localities tested to decline compared to first studied year. From 2019 onwards, the number of localities with outbreaks decreased in both areas. EBL outbreaks were observed in a substantial proportion in the localities in entire county. Nevertheless, outbreak seems to decline in time, which is good in both area for the county. In all studied years, the outbreaks incidence at locality level were significantly higher in the Danube Delta area compared to the mainland. An unexpected pattern was observed in 2017 for the number of infected animals in Danube Delta. This might be attributed to the transcription of the outbreaks from one year to another. Worth mentioning that no farmer requested animals testing for EBL during this year. As a discussion, the important difference for EBL incidence between the both areas, Danube Delta and mainland, could be the result of existing legislation that states that all mainland cattle owners are required to test their animals. However, cattle owners from Danube Delta do not have to comply with this regulation, resulting in a likely underestimation of EBL incidence in the region. Both the EBL transmissions path and the level of precipitation and temperature from a studied area could have influenced the disease transmission. The only local cattle breed, Dobroja Red, has the high susceptibility to our studied disease, EBL. The current CP for EBL in the Danube Delta could be significantly improved if data collection and diseases event reporting would be refined. Furthermore, the low numbers of state veterinarians in this county leads to reduced efficiency in diagnosis and control of outbreaks. In Danube Delta region is problematic when it comes to EBL spread and prevention measures, given the environmental protected status of the UNESCO site, adding to the semiferal rearing condition of bovines. Thus, insect management and examination policies cannot be applied. And as a conclusions, continuing improvement in the Romanian epidemiological situation concerning EBL to accomplish the objective of total EBL eradication, effective collaboration between veterinary services, farmers, and local administrative institutes is required. And thank you for your attention.